All right, warm greeting from Geneva, Switzerland. I'm Reda Sadki, and I'm here with, of course, Charlotte and Boo. If you're new to the Geneva Learning Foundation, of course, we'll be introducing ourselves. We are just 1 minute and 51 seconds away from kicking off this partner briefing. Now, this is in preamble. This is the second partner briefing we are doing. Why did we do two? Why did we do a repeat? Well, very simple. For the first partner briefing, we were pleasantly surprised to see 105 organizations respond to the call, expressing interest in learning more about becoming a Teach to Reach partner. And what's even more remarkable is for this briefing today, an additional 43 organizations. Altogether, there were 16 ministries of health who expressed interest for the first briefing, and increasingly we've seen national teams from ministries of health joining and participating and contributing to Teach to Reach. We'll be telling you more about that, but that makes it all very exciting for us, as this is going to be the 10th edition of Teach to Reach. We'll be explaining you, if you're not sure what exactly Teach to Reach is, with Charlotte, we're going to be explaining all of that in 50 seconds. How is it going for you, Charlotte?
Great, Reda, and really looking forward to today's briefing. I think we are going to be entering some specifics into what happens before, during, and after Teach to Reach, and very ready to answer all of the questions that you may have. Thanks, Reda.
All right, thank you. All right, and indeed, in just 30 seconds, and we like, this is the immediacy of being connected to each other as human beings is what we're trying to convey. That's why you'll hear music and maybe even applause. Even though this is a partner briefing, it'll also give you a flavor of what to expect with Teach to Reach, and we'll be giving you the specifics in just 10 seconds. Here we go. All right. So first of all, this is a part of a series of coordination check-ins. So if you do decide to proceed and support, join, contribute, benefit from Teach to Reach in various ways, you'll see there are more dates, and you'll be receiving automatic notifications. Of course, if you do not want those, please do unsubscribe. You can see here what's coming. Now, we're going to cover a lot of information in very little time, and this is very different from what we usually do at the Geneva Learning Foundation, where we engage with you in peer learning, encouraging you to share your experience. Here, the point is really to give you all of the information across all these 5 points that you need to make the decision. Is this of interest? Is this of value for my organization? Should my organization become or not a partner? Now, one of the ways to answer that question, and this is actually the way that we want to kick off, is to say, well, is your organization interested in any of these themes, topics, issues, diseases, I should say, that are these relevant to your work? If they are, well, these are precisely some of the themes that we are interested in engaging in, because our community, the Teach to Reach community, this massive open community of health workers, has said these are issues that matter to the community. So we have, Charlotte, could I ask you to run through this list?
Yes, Reda. So we have community engagement to sustain malaria action. We have other vector-borne diseases, yellow fever, dengue, and others. We have integration into routine immunization of polio in high-risk areas. We have engaging communities to take action to combat neglected tropical diseases, and cross-cutting Teach to Reach functions that partners can support include, we have knowledge translation of research and evidence into actual use, and then locally led action to reach the unreached and marginalized. And we'll be talking a little bit more about this.
And that's not all, right, Charlotte? There's more.
Yeah, that's not all. Yeah. So there is understanding mental health in communities without mental health and psychosocial support services. We have supporting the introduction of new products and services, gender equity, responding to the needs of women and girls, and sharing lessons learned from onchocerciasis and other neglected tropical diseases.
And so you may be wondering, how does one event pack all of these issues in? How can anything useful come out of it? That's also what we're going to explain. And if you don't see what your organization is interested in here, let's talk. If it connects to the needs of the Teach to Reach community, this is a massive community of health workers, then we should definitely be talking. Now, just to introduce the Geneva Learning Foundation, we research, develop, scale up new ways to learn and lead against the critical threats. Teach to Reach Connect has emerged. It has grown organically. I'll be showing you how much it has grown and how quickly within a few slides. It is a regular event for healthcare professionals to meet, network, and learn primarily from each other. But it's also an amazing way to reach, engage health workers, hence the interest of many, many partners. Now, the invitation today is addressed to the National Ministry of Health teams, and we know that 19 of them have already responded to country and regional partners, global partners. And then, of course, what's going to be new with Teach to Reach 10 is many of the individuals who've participated are coming from, are affiliated with civil society organizations, health government, health CSOs. We're going to be inviting you, if you're a CSO leader, to actually become a Teach to Reach, for your organization to become a Teach to Reach partner as well. Now, we've been blessed by a distinguished group of partners, including those we call anchor partners, Gavi and UNICEF, who in the past have supported, partnered with Teach to Reach. But what we want to do here is just to show you in a few slides, and this list hasn't been properly sorted or cleaned up, is really show some of the organizations that have already expressed interest. Hopefully you will see we haven't actually updated this list with the 43 new organizations, so you can see here, but just to give you a flavor of who is likely, which organizations. The individuals we'll also tell you about, but here are some of the organizations that have shown interest, responded to the call to attend these briefings. Now, ascendant participation of many digital events start off well. That first webinar, that first event that goes really well, lots of people, and then it declines. We've seen the opposite with Teach to Reach Connect, and you can see here that there's what we would call a healthy mix of health professionals from different system levels. And you can see, of course, June 2023 was 16,835. The October 23 Teach to Reach event, so just a few months after, when it took us to 17,662. We'll explain how before, during, and after Teach to Reach, you can actually make sense of, do useful things that lead to impact, that help health workers on the ground achieve impact at that scale. We talk a lot about scale in global health. If it doesn't scale, it's probably not going to provide the solution. So this is for learning, what we think of as part of the Geneva Learning Foundation's research and development, exactly such an effort. Now, who attends? Health work for government, health work for CSOs, health are francophones, and then you can see some of the specific issues and fragilities that Teach to Reach participants deal with. 1 in 5 worked in armed conflict, for example. And what we really emphasize, and this is super important for partners to understand, is that what's important here is the relationship and the learning between participants. You have these two sort of nodes because of French and English language groups, even though there are multilingual sessions. And that is really key to understanding how peer learning is at the heart of Teach to Reach. Now, global leaders like Dr. Kate O'Brien and Ephraim Tilomango from WHO and UNICEF, respectively, have said uniquely Teach to Reach provides a way to link health professionals together so that they can share experiences about what works. To us, it is equally important what Atahir Abubakar, who works in Zamfara State, Nigeria, has said, and has really expressed beautifully. He says, our collective experiences and passion can transcend borders and overcome even the most formidable public health challenges. Now, just to mark a pause, indeed, as Charlotte has put into the chat, let's have a look here. Please do introduce yourselves and your organization if you wish. You do not have to. And we'll keep sharing what's in the chat. This second briefing is not, we live streamed the first briefing. We're not live streaming the second. 43 additional organizations joined the partner briefing, so we really wanted to engage them, as well as 3 additional ministries of health. Now, at the top of the agenda for Teach to Reach 10 will be actually it's a theme that we introduced at Teach to Reach 9, and that is really on the front line of climate change and health. Just as a reminder, in July 2023, we had our first special event. 4,700 health workers responded in less than 2 weeks, sharing together 1,234 detailed observations. Now, they told us most of them consider themselves to be part of the family of the local communities they live with or a trusted friend. And they told us significantly that climate change to them is a threat to the health of the communities that they serve. So if you are a partner who works on climate and health, there are 3 reasons why we would encourage you and be pleased to welcome you into the family of Teach to Reach partners. One is to show your support in practical ways. If you are, for example, funding policy or science at the global level, this is an incredibly good way to say, look, this is what we're doing, and to begin engaging with people on the receiving end of global level work. Second is, of course, to listen and learn from Teach to Reach participants through plenary sessions, through one-to-one networking, through Teach to Reach questions. And then 3 is, of course, you can present your tools, the opportunities that you offer, the initiatives, activities, events, and so on. We really want to have Teach to Reach be this open platform for everyone. Now, alongside climate change and health, as you saw in those initial slides, there are many, many different topics. There's an ongoing theme with a very active, vibrant community discussing neglected needs of women's health and neglected tropical diseases through FGS, a disease that affects an estimated 56 million women and girls in sub-Saharan Africa. And of course, every Teach to Reach edition has been under the banner of the Movement for Immunization Agenda 2030. At Teach to Reach, you'll continue to hear amazing, remarkable stories of leadership around immunization, but also primary healthcare. Increasingly, you can see a few of the folks we've honored in the past here. Partners may be specifically interested in the Manifesto for Global Health. So this is a document that's been drafted, worked on, contributed to by over 1,300 health professionals, and we'll be presenting the latest version at Teach to Reach 10. Is something that we encourage partners to specifically engage in. And again, there are sort of Teach to Reach specific themes that are ongoing. You can see some of them here up on the screen. Now, we want to tell you what happens before, during, and after Teach to Reach. Yes, it's happening on the 20th, 21st of June, but actually what happens on those 2 days may not be the most important for participants, but also for you as a partner. I'm going to try to explain. It's a bit of a different process. It's what we call complex learning. So let me try to sum it up. Teach to Reach is about the sharing of experience. We believe that by tapping into helping people connect with what they know because they're there every day in ways that people in Geneva, London, Washington, or Seattle simply cannot be. There is much to learn, first to serve the needs of communities, but also for global partners to learn from that. So for Teach to Reach 9, for example, that meant there were 1,786, I believe, experiences shared ahead of Teach to Reach. This was then given back to the community, providing deep insights across the range of issues that were on the agenda for Teach to Reach 8. This is for Teach to Reach 8, but the same across each Teach to Reach. And as we build up towards Teach to Reach 10, we're going to be sharing questions, what we call Teach to Reach questions. We're also going to be running a series of activities I'm going to tell you about now. We just celebrated International Women's Day, so we asked questions to the Teach to Reach and to the Geneva Learning Foundation community network and platform, and have just published, I'm very pleased to share on Friday, we published a collection of voices, 177 women who contributed, again in a very short time, to this collection. I'm hoping Charlotte has or is going to post the link if you'd like to take a look at that. Some remarkable, inspiring stories indeed, and that is part of the build-up to Teach to Reach. The collective of women who deliver vaccines will also be very present and visible. They have opened every Teach to Reach since their creation, and as I said, we'll have a big focus on neglected needs of women's health, and in this case, neglected tropical diseases. Now, in the build-up to Teach to Reach, we love sharing this amazing picture. We're working a lot on visual storytelling, and we're doing this with the Geneva Learning Foundation's first fellow of photography. He's going to lead a workshop next Monday with healthcare workers from 44 countries. 80% of the participants work in so-called fragile contexts, so facing difficult circumstances, to be a little less euphemistic, and you can see the countries here. In 2022 and 2023, immunization staff, that was the initial focus, shared over 2,000 photos within a few weeks each time. You can see some of the, we've published already 2 collections of that. Now, let me see how we're doing with time. Please do post your questions into the Q&A. All right, and thank you for more, Fuen. I hope I'm not mispronouncing your name. We're going to answer how an organization can become a partner, of course, within a few seconds. Now, I mentioned Teach to Reach questions. They are really core to the Teach to Reach experience. Everyone who registered is invited to share their experience. People choose to respond or not. The questions are specific. If you don't have the experience, you're not expected to try to answer any specific questions. And we honor Teach to Reach contributors before, during, and after Teach to Reach. Now, what happens at the event itself? So basically 3 things. You meet, you network, and you learn. And there's, of course, a conference networking platform. There are English sessions on Thursday and French sessions on Friday. And there's one-to-one networking in both languages during 2 days. I'd like to mention, I don't know if our colleague, yes, of course, she's here, Maria Monzan from Argentina is here, but she is one of the many reasons. There's a Latin American network of around where we reach around nearly 2,000 public health professionals in Latin America, but right now we're missing the sponsor to offer Teach to Reach in Spanish. Now, one-to-one networking sessions, you click on a button and you connect with another health worker and can have a discussion on one of the Teach to Reach themes, but also on anything that is meaningful to you within a professional context. We then ask you, after Teach to Reach, what did you learn from that? What are the insights? And that builds up this incredibly rich peer learning knowledge base. Complementing global guidance, norms and standards is really that experiential knowledge that helps us get at the local levels to the how. Now, for people with low connectivity, we offer a audio-only podcast, which makes it very convenient to listen to everything that happens in the public spaces of Teach to Reach. Unfortunately, it does not replace that immediacy of one-to-one networking. So what happens after Teach to Reach? Well, we ask you to share your insights, your learning, your reflections, so as Teach to Reach participants. And that then goes into what we call the Knowledge to Action Hub. And this Knowledge to Action Hub is multiple channels, multiple pathways to actually support individuals and organizations taking what we learned from Teach to Reach and translating it into action. So now we finally get to the main question, the main purpose of this briefing, which is how can your organization become a Teach to Reach partner? So first question is actually, are you a partner or a sponsor? So a partner is invited by TGLF. It will put your logo and link to your website, and there's an opportunity to engage with Teach to Reach participants in a dedicated workshop. So if your proposal for a workshop is accepted, then of course we'll support you in every way that we can. Now, sponsors, there are 3 tiers of paid sponsorship. So that's gold, silver, and bronze. And that is how we keep Teach to Reach going. So it's an incredible opportunity for global funders, global partners to really show that engagement and that support, do more than just express intent and goodwill, but actually help keep this remarkable event going. And we're grateful to the amazing sponsors that have supported Teach to Reach since the very first edition. That was supported by the Bill and Melinda Gates Foundation. And we've now got a range of funders, but it is still difficult to convey how important and how valuable it is to have a platform, community, and network such as Teach to Reach. Now, for global partners, the opportunity is really to connect, listen, engage, and support. The opportunity, if you are in interested in a specific disease or theme is actually to gain some new insights and knowledge that can lead to action through not just only through Teach to Reach, but through the Geneva Learning Foundation's a broader approach and model. And an example is the way we foregrounded FGS over several Teach to Reach sessions. Now, if you're a research organization or funder, you can see Teach to Reach, think of Teach to Reach as a platform for knowledge translation, where you can present your research outputs. Now, we can do more than present and disseminate. We can actually track, using the Knowledge Action Hub, actual use of a resource and feedback on what difference it makes on the ground. So if this is of interest to you as an organization, we're very eager to speak with research organizations and funders. You can also, of course, listen and learn to inform the design of research. You can collect data through Teach to Reach questions. That's open to the gold tier of sponsors, as well as to selected partners. And then you can, of course, share surveys and other instruments with health workers. It's a really, really super high response rate with one commitment. And that is that we work with partners to ensure that what you're going to get, what you're going to learn, is shared back with the community to its benefit, or else we will not engage. And that is the Teach to Reach community as a whole that operates in this way. The opportunity for local organizations is really to meet, network, and learn, and also profile your organization with Teach to Reach participants, but also with global partners through the workshop. Now, I'd like to invite you, if you have not done so already. We are doing increasingly, we're shifting from a email model where we communicate with you by email to social media. And so in the coming weeks, there'll be many opportunities, and we'll be calling on partners to help amplify Teach to Reach 10. Now, one note about the partner workshops. There are 3 options that have worked well in the past. The first is a listening session. So second is a presentation. And then the third is a more interactive dialogue. One thing we explain to partners about the workshops is that they run concurrently with other sessions. Teach to Reach is a very busy, incredibly dynamic sort of platform time, and we can't predict how many people are going to show up for your workshop. So we really emphasize partners should be promoting their own sessions, and then that is where we coordinate for social media, through social media and other communication channels to make sure that you really achieve what your goals are as a partner. So to finish this briefing, we wanted to give 2 concrete case studies. The first one is about the first one is a quote from the partner whose support enabled us to start Teach to Reach in 2020. And this is Yolene Mitchell from the immunization team at BMGF, who said, the Geneva Learning Foundation is actually setting the pace for how we do things in the future. Now, first case study is with UNICEF. So this was Teach to Reach 9. We focused on identifying and reaching zero-dose children with vaccines in urban and peri-urban settings. We worked with those we call guides on the side. So there are no PowerPoint presentations, unlike this briefing at Teach to Reach. Guides on the side are global experts who listen and then share their feedback. So UNICEF was interested in understanding how to reach what's working on the ground in terms of reaching zero-dose children in urban settings. So we asked this simple question: can you share a success story, a lesson learned, or a challenge? But we did this knowing and inviting specifically the 42% of IA 2030 movement, so immunization staff that we reach that work with the urban poor. And so we asked actually 7 sort of sets of questions, quite complex, quite refined. In many cases, we got very rough answers back, but we also gained great insights into the details of a question, for example, around reaching zero-dose children in informal or illegal settlements. So Ephraim Lomango, Chief of Immunization at UNICEF, had this to say about his partnership with Teach to Reach. We've said we want to listen. Co-creation is very important. This is exactly the type of innovative approach that we need to overcome the complex challenges we're faced with global health. So that's one. If you have, let us know if you're a potential partner or sponsor in the room. Let us know how this resonates with you. Could this be useful to you? Are there things we haven't addressed or mentioned that actually you're looking for in terms of what you'd like to do, how you'd like to engage with health workers in districts, facilities, but also at the regional and national level? Second case study is from Dr. Folake Olayinka. So in this case, she was wearing her hat as the chair of the IA 2030 working group. So IA 2030 is the world's immunization strategy, immunization agenda 2030. She's also the team lead for immunization at USAID. And so she said the inputs and points raised by panelists, so this is after Teach to Reach, were very insightful, actual experiences, opportunities, challenges, and enablers on the topic. You can read the rest of the quote up on the screen. Now, I told you that with respect to knowledge translation, we do not stop at dissemination. We can say, so sure, we can tell you, 17,672 people have received the information about your latest output, guidance, whatever you'd like to share with the community. But we can go a step further, and that is what we did with Folake Olayinka and her colleagues working on primary healthcare and immunization. The working group had cooked up a new framework for action. And so what we did through the Knowledge to Action Hub is we asked 30 and 90 days after, what happened? What did you do with the framework? Did you find it useful? Tell us how it turned out. Do you have any suggestions for how to improve the framework? And then what we got back, we got lots of health professionals who apologized, saying they were too busy. And that is understandable. We also got people who said, great framework, but didn't share anything specific about actually reviewing it, much less using it or applying it. But we also got credible, specific narratives of actual use, including adaptation at the local levels. And that, we believe, opens up new avenues for global partners that are issuing global guidance, norms, standards to really shift how they think about the relationship they have with people on the ground in the field. And we know there's a lot of powerful, really strong intent to listen, to learn, to do better in terms of paying attention, recognizing that what happens at the local levels is where ultimately public health works or not, happens or not, saves lives or does not, and so on. And so that is where we're hoping that Teach to Reach 10 and beyond can contribute to the work of partners, whether that's at the local, regional, national, or global levels. I'll stop here. I hope this was not too much information being pushed at the same time. The recording will be available, of course. And I want to see if there are any questions. Okay, there is one question from Fulmore Fuen. How can an organization become a partner? So you'll be soon receiving a specific request for organizations that are national or subnational to become a Teach to Reach partner. So do look for that. All right. And it looks like, okay, thank you, Irene. I think it's brilliant that you're using AI to summarize the meeting. I don't know if Irene is actually there or only her AI. Charlotte, I'm going to turn it over to you to see if there are any questions. If you have questions, you can put them into the Q&A, or of course, just raise your hand. We'd love to hear your voices. There's just 5 minutes left, but we hope you can. You will be asking questions if you didn't see a theme that you're interested in, for example, let us know. If conversely, we'd love to hear your excitement. If this actually corresponds to something that you believe can help your organization, you're also welcome to tell us that as well. So please, we only have a few minutes left, and it could be that similar to the first briefing, we actually got very few questions. We always hope, somewhat immodestly, that this means the briefing is so complete and comprehensive that it leaves no questions, but we know it's not that. It's probably just a lot to take in. Over to you, Charlotte.
Thank you, Reda. Just looking forward to anyone who wants to take the floor. If you have any questions or comments, as Reda just said, feel free to raise your hand, and we'll really be delighted to invite you to unmute yourself and to tell us, or to ask your question, or to tell us what you think about participating in the upcoming Teach to Reach. And
all right, then Asha Jyoti just says a very good briefing. We'll be in touch. Asha from Swati. I hope it's okay to be showing the chat on screen, but thank you, Asha. Does that mean it leaves you with no questions? In any case, I'm happy to introduce Dr. Maria Fernanda Manzon, who's just joined our team, but actually she is a longtime scholar, which means she is an alumna of the Geneva Learning Foundation, who has distinguished herself in past programs right up to climate and health. Maria, would you like to say hello? And then in the meantime, if you have questions, please put them in the chat or raise your hand so that we may hear from you. Maria, please do introduce yourself.
Thank you, Rita. Hi, everyone. Good morning, good evening, and good afternoon. As Rita was telling you, I am Maria Monzon. I'm from Argentina. He had mentioned earlier that we're planning on having Latin America be part of Teach to Reach, a Spanish version in a near future. Hope so. I'm very happy to be here. As we were just saying that maybe there are no questions now, but feel free, if our meeting is going to end in a few minutes, you can reach out to us through our social media or through an email to any of our addresses, and we are happy to have a one-on-one discussion if needed, or to answer them in that way if anything comes after you go through that.
Thanks, Maria. And actually, I have a suggestion to make, is that, Maria, is it okay if people reach out directly to you as our partnerships coordinator?
Definitely.
For Teach to
I'm
Reach?
putting down my email there.
Okay, wonderful. Thank you. Yeah, and that's the main. So we realize this may be a little bit overwhelming, but we would love to engage with you. And Maria is really front and center right now. She's the key person alongside Charlotte and myself, but she's really going to be okay. Wonderful. If you have any questions that you don't want to ask in this forum, then you can reach out to her. And if you're actually interested in becoming a partner or sponsor, do reach out directly to her. You should have now received a link. Let me just get this. You should have received already a link if you registered before last Monday. You should have received a link to actually formalize your expression of interest as a partner. So do look for that. May not be entirely clear what it is. The deadline is this Friday, however, to confirm your interest. I think that's it for this session. Thank you very much indeed. And if you'd like to get any last messages into the chat now. Okay, wonderful. Caroline Akosile from the We Lead Network in Lagos, Nigeria. Yes, and I really hope that the We Lead Network will be a Teach to Reach partner. Thank you, Caroline. Thank you, Dr. Shibli Said. Vivienne, wonderful to see so many great partners in the room. And always to see Nigeria very well represented. Nigeria and DRC are the two largest communities of the Geneva Learning Foundation. Those we call scholars, learners, participants, leaders, implementers. Wonderful to see you here. Cindy, we use Telegram due to spam on WhatsApp. So we'll definitely be sharing that with everyone. All right. Wonderful.